universal access to mental health care is something we said that we were going to do in 2021. So the announcement yesterday is really a big step forward to fulfilling that commitment. We did announce the first step of our publicly funded insured service program. So, psychologists, master's level social workers, and registered counseling therapists will now be able to deliver publicly funded care starting this spring, primarily for non-urgent anxiety and depression, which we know has significant impacts on the day-to-day lives of many Nova Scotians.
Now, we've talked here on this program an awful lot lately about mental health concerns and serious issues that have emerged. A lot of conversation about intimate partner violence of late, the impact of PTSD in the society, mental health affected by drug addictions and other addictions and so on. And we're beginning to see, in fact, we now have a psychotherapist to come on this program twice a month to talk about these kinds of issues. But in talking to you, we should set the record clear here. That's your background. You may be a politician and a cabinet minister now, but your background was as a nurse in mental health. You've been on the front lines of this issue. You've witnessed the growth and the impact on society, on our economy, and every aspect of life. You were there, saw it firsthand. Now you're in a position to do something about it. I thank you for that and applaud your effort.
Thank you for the kind words. Yeah, so before kind of getting into public office, I was a psychiatric nurse, primarily in Cape Breton. So my background is primarily acute psychiatry. So I'd often, try to help people with, my colleagues, in acute states when they were quite sick. So I think this program, trying to give folks access to non-urgent care, can really give them timely access to care, which, would be helpful in, not getting sicker, right, and having to need, acute care services in a hospital setting. So very privileged, I think, to have this opportunity to be able to kind of move this forward, and certainly very, happy to have the support of the Premier as well.
Well, Minister, as you probably well know, your cabinet colleague, Tory Rushton, is a local MLA for us, and as a consequence, he's with us every week. Every Wednesday we talk with him, and in talking to him yesterday, he spoke about how ever since you were elected, that you've been, I don't mean to make it sound light or trite, but you've been pounding the drum. You've been telling them, you've been setting the foundation for your cabinet colleagues. And of course, you weren't in cabinet at the time when you first started telling them, setting the foundation for them to understand how big this problem is. And so big, in fact, that the Premier created the new cabinet position, and I think quite rightly selected you to head that department. So this is your baby from the get-go. And I'm just wondering now, you have the reality sets in that the need is there, the services can be there. Now you got to pay the bill. And you've started off with a $10 million investment, but your announcement yesterday said the next thing you have to do is figure out who and how to pay the bills.
Yeah, so since 2021, so we formed government then, the portfolio was created. There's been an increase of $125 million in the Office of Addictions and Mental Health for the province. Significant investments in the publicly funded system. As you noted, the $10 million announced yesterday is really part of, there's some logistical components with the billing administrator and some sort of logistical aspects for clinicians, but the vast majority of that will be spent on direct patient care through, funding clinicians. So that's always been the focus, really frontline care, access to care for people across the province.
But what I was getting at, too, is the fact that when it comes to time you go to a doctor, for example, you don't even think about payment because it's all taken care of behind the scenes, and the billing administration is there. It's done as a kind of insurance system, certainly, but it sounds like you're not planning to join the current system with the rest of healthcare. You're looking for a billing administrator. What does that mean?
Yeah, so as you said, if you go get an X-ray, or if you wanted to get your glucose checked, if you were had some issues with diabetes, that would be part of the publicly funded system. So this is essentially just creating another access point for mental health care to be publicly funded. There's certainly, I would, again, venture a guess because the procurement is posted right now, but there would be some similarities in payment mechanisms and those sorts of things. So we'll have more information with that, in the coming months. But it will be publicly funded, which I think is the main thing.
And the other difficult thing to grasp and understand and deal with from your perspective as an administrator is when you go to the hospital, you're dealing with doctors, nurses, and well-defined roles. But when it comes to mental health, we have psychiatrists, psychologists, we have all other levels of people who care and show empathy and provide counsel. The lines or definitions are not clear. So, what you said, you're going to have to identify who provides the services. That's going to be a big task too.
Yeah, so this will be the first phase of the program. So this will really focus on psychologists, master's level social workers, and registered counseling therapists. So we've had a number of conversations with those specific groups over the last number of months. There was a great deal of interest at that time. I actually had a couple folks reach out actually overnight, asking for information because they wanted to participate in the program already. So I think it's a really positive step. But this is the first phase. There's three disciplines, specifically mentioned, but we know there's many more out there across the province that deliver really high quality care to folks. So we'll certainly be, engaging with them as things move forward.
Now, what are the numbers now? We talked about the rising incidence of issues that impact on society, usually involving the police. And we've often talked about the fact that the police are ill-equipped to deal with mental health issues. Do you see the services breaking down so that we're no longer sending out the police when a response really needs to be somebody with a gentler touch?
If you really get to folks when they initially reach out to care, typically you have that window of time, right, when people really want to get care. If we're offering, quicker access to care when things are, don't get to an urgent or crisis level. That being said, we do have a pilot that will be starting up late spring, early summer in the Windsor area, which is a non-police led community outreach sort of based model, like with a kind of specific cases like you would have mentioned. So we'll monitor that closely, evaluate it, and certainly, we'll look at kind of situating that across different areas of the province once kind of we get the data to kind of see where that's headed.
Now, in terms of numbers, you no doubt have your finger on that. When we talk about the issues, of course, we think of places like the Nova Scotia Hospital. We think about services at the IWK and others at the larger hospital centres. What are the numbers that you're looking at that need help today?
Yeah, in terms of access to care, I think, within the province, we do a good job with urgent care. Like our benchmarks are always met within 7 days for folks to reach out for urgent care. Obviously, if anyone is in a crisis, they get, immediate access to care through our acute care system. I think historically where we've really struggled, for the last 10 years or probably longer is the non-urgent cases for folks for care, both for child and adolescent and for adult. So it's really difficult to give specific numbers, but I would say this, the main idea behind this was quicker access to care that will gradually bring the demand down for non-urgent cases for people.
Now, I mentioned earlier about Tory Rushton talking about you and your background, and it must be really something special. He said that you entered politics to address this problem. You must be very, very proud and happy, and your colleagues must likewise be very proud of you for getting it done, so to speak.
Yeah, no, I did leave frontline healthcare in 2019 to kind of, learn the ropes, I guess you would say, so to speak, for a couple of years before we formed government. But this was something that I discussed with my colleagues, and he wasn't the premier at the time, but back in 2019 about this kind of universal mental health care. So I was very thankful to have that support. And this is a significant step forward. I think there's certainly more work to do, but certainly feel very privileged to have this opportunity, and certainly something I'll want to see through.
Well, you're obviously persuasive because you come into it, pardon the expression, as a rookie, but very, very quickly had an impact on your colleagues and very quickly had an impact on your leader at the time. As you say, he wasn't premier at the time, but impact on him to instill in him this very important need in society. And moving from there, just a remarkable transformation. And on top of that, you sound like, and everybody tells me, you're one of the good guys. You're a nice guy, too.
Yeah, I don't know about that, but it's certainly you do the best you can, I think, with the opportunity that you have. I'll certainly try to do that. I'm very fortunate to work with some really good people and have the support of my colleagues.
Indeed, indeed. And I want to thank you for being here. Appreciate the fact that you've taken time out. You had the announcement yesterday, and here you are today talking with us. I have a funny feeling that we'll be talking again, and I certainly look forward to that.
Yeah, I'd be happy to. Thanks for giving me the time. It was greatly appreciated.
Oh, I appreciate it that you be here with us. We're very open and welcoming you. I would invite you at any time that if there's an issue that you want to address that we haven't picked up on, calling you for an interview. If you've got a message to get out any day, we're here on this live program, 10 to noon, 5 days a week. We can always get you in here to get your message out.
I really appreciate it. Thank you very much.